It's a much more common condition than people think, and recent research shows that 4 in 100 women under the age of 40 suffer from this. Hi, I'm Dr. Ashley Shadharaman. I'm a GP and an advanced menopause specialist, fully accredited by the British Menopause Society. I work at Medical Prime, which is a private menopause clinic in London. Today I'm going to talk to you about a condition called premature ovarian insufficiency, also known as POI. So what is POI? Well, POI is a medical condition where the ovaries stop working normally before the age of 40. The ovaries produce fewer or no eggs and stop producing the hormones estrogen, progesterone and testosterone. It's a much more common condition than people think, and recent research shows that 4 in 100 women under the age of 40 suffer from this. So what are the causes of POI? Well, the underlying causes of POI can be difficult to pinpoint. We know that in some women, POI is associated with genetic abnormalities such as Turner syndrome or Fragile X syndrome. In other cases, POI is linked to autoimmune disease such as type 1 diabetes or those that affect the adrenal or thyroid gland. Some women may experience POI as a consequence of having their wombs or ovaries removed surgically. Treatments for cancer, which include radiotherapy and chemotherapy, can also affect the ovaries. Actually, for a majority of women, in fact over 90% of women, there is no underlying cause found, and this can often be unsettling for women diagnosed with POI. So how do you know if you have POI? Well, if the ovaries are no longer producing the hormone estrogen, women will develop menopausal symptoms at a much earlier age than expected. Physical symptoms include irregular or no periods, hot flushes, night sweats, poor sleep, vaginal dryness and soreness, low libido, and difficulty conceiving. Emotional symptoms can present as anxiety, mood changes, difficulty concentrating, and issues with memory. Women with POI can often experience feelings of grief, uncertainty about their future. They may face challenges about starting or expanding their families. So how do we diagnose POI? Well, POI is diagnosed in women under the age of 40 who have had at least 4 months of irregular or no period and have a high level of follicle-stimulating hormone. This is checked by a blood test. Additionally, a low estrogen level can also help confirm the diagnosis. Once POI is diagnosed, further tests to check for autoimmune disease or genetic tests can also be done to look for underlying causes. So what are the consequences of POI? Unfortunately, we know that if POI is left untreated, there can be serious long-term health consequences. This is mainly down to the prolonged lack of the hormone estrogen. This hormone is crucial for bone, muscle, heart, brain, and sexual health. And without it, women face higher risks of osteoporosis, cardiovascular disease, and also mental health challenges. There is a small chance that women can get pregnant naturally, but in the majority of cases, women will need help conceiving and having children. So what is the management of POI? Well, while there is no cure for POI, a combination of medical treatment, emotional support, and lifestyle changes can help alleviate symptoms and reduce long-term health risks. Stopping smoking, reducing alcohol intake, eating a balanced diet, and exercising are all essential. Emotional support in the form of therapy, support groups, and stress management can help enormously. However, the mainstay of treatment is hormone therapy. The British Menopause Society recommends that all women who are diagnosed with POI should be offered treatment with hormone replacement therapy until at least the natural age of the menopause, which is thought to be 50. Adding back these hormones can notably improve physical and emotional health and help prevent long-term problems. Women with POI should be under regular follow-up and monitoring by a specialist to ensure that they are on adequate treatment and are being supported so that they can enjoy long, healthy, fulfilling lives.